Well, good morning, everyone. It's so great to be with you this morning. And I'm Joan Hughes, the President of COTA New South Wales, Council on the Ageing New South Wales. So, welcome to today's webinar. It's great to have so many of you joining us, and there are people I can see coming in as I'm speaking to you. As you know, that these webinars and conversations have become a regular thing for COTA New South Wales, especially during COVID. We thought it was a great way to talk about issues and for people to connect um, through Zoom. So, guess what we're talking about today? We're going to be talking about aged care. And many of you would be aware that there's been a Royal Commission and there are recommendations, and we are watching those very carefully at a national and at a state and territory level. Usually we start about now 10:30, we finish about noon, but today we're going to have a slightly longer session because we're going to be talking to one of our staff people about aged care. So we have some great people with us today. So today we have Paul Sadler. He's going to be joining us. Many people might know of Paul, and we were just talking before we started today. Paul and I have known each other for a very long time. We have Judy Christian. She's one of our community speakers. That's a program that COTA New South Wales runs. And of course, we've got Terry, one of our staff members. Um, I'm really, really excited to be with you because I've missed you. I haven't been for the last two. The reasons I've moved house, and so I'm now in the Kiama area, so that's the Ewan Nation. And then I got COVID. Could you believe that? I thought, oh goodness me, I'd had my fourth vaccination, and then I got COVID. So I've been getting over that and back to my normal self, but just have a bit of a niggly cough. So yeah, so bear with me. Before I get started today, I would like to acknowledge the traditional custodians of this land that we all are meeting on this morning, and I pay my respects to elders past, present, and emerging, and extend that deep respect to First Nations people who are joining us today. As I said, I'm on the Yuin Nation, and once upon a time, this area was in Indigenous language, it was the place where the sea makes a noise. So if you know the Kiama part of New South Wales, you will be, excuse me, you know there's two blowholes here, one very large one and one smaller one, but it is a beautiful part of the world. So for those of you who aren't sure, as I said, COTA New South Wales, we stand for Council on the Ageing, and we're the peak organisation in New South Wales for people over 50. We are a policy and advocacy organisations. We work with politicians, with policymakers, service providers, and the media to make sure the views of older people are not just heard, but are acted on. We also provide services for older people, including legal pathways, the Aged Care Navigator Service, Living Longer, Living Stronger, Older Men New Ideas Group, and the Community Speakers Program. And one of our community speakers, Judy, is with us today. So just a little bit of housekeeping, folks. Um, all our presenters at the moment, they're on mute. You excuse me, you aren't able to unmute yourself because this is what we call a webinar. It's not a meeting. So the panel, you can ask your own questions at any time by typing them into the Q&A panel. And you can also upvote someone else's question if there's something that you would like to know. And we'll be trying to answer as many of those questions during the panel discussion. There's also a chat panel where you can make a comment during the presentation. This event is being recorded and it's available from tomorrow on COTA New South Wales YouTube channel. I always get excited when I say that. COTA New South Wales YouTube channel, along with all our previous webinars and conversations. So check those out as well if you've got some free time. So, folks, we're here to talk about aged care. You know, I've been around for a long time, and when you look at the number of inquiries and reviews into aged care in Australia, well, they've been happening since 1997, and there's been over 30 inquiries and reviews. And none of them really has led to a system where people are able to access the care they need and the care of quality that they need. So then what happened, of course, COVID hit and further highlighted the problems in this system. Earlier on, there were infection control issues. There were months where people couldn't visit their loved ones and friends, and there are ongoing staffing issues as COVID rates remain high. As well, many older people died alone. If you look at the stats today, 17 more people have died of COVID in New South Wales. Even without COVID, a recent Committee for Economic Development of Australia, in brackets, some of you might know that organisation as CEDA, their report highlighted the need for significant staff increases in aged care to meet the growing demand. The report estimates that 17,000 new direct aged care workers are required each year to meet the basic standard of care for older people in Australia. I know within my family, when I had to put my dad into an aged care facility, he was really, really scared. And many older people are fearful regarding care, especially going into a residential aged care facility when their whole world changes. But this shouldn't be the case. While everyone would like to be independent forever, care will be necessary for many people at some point as they get older. And as our population continues to rapidly age, it is important to get the system right so that we are able to provide care for people at one of the most important stages of their life and care when they need it most. The regular message my father told me during my visits with him in residential care, he'd always say, as I left, he'd say, "Sweetheart, the days are so long." And what my father really needed was daily, meaningful contact with people who cared for him. His physical care was pretty okay, but his emotional care was lacking. So we're very pleased to be joined by a couple of excellent people to discuss the issues this morning. And the first person that I'd like to introduce is Paul Sadler. Paul has worked in aged care for more than 35 years and was appointed the interim CEO of the newly formed Aged and Community Care Providers Association in May. He started his career as a social worker, working with family carers, and has worked as an ACAT assessor. He's managed tax services in New South Wales and led a large non-for-profit aged care provider. Paul has a deep understanding of the aged care system in Australia, and we're so pleased that he can join us today. So over to you, Paul.
Thank you, Joan. And it's a pleasure to be here with COTA New South Wales. Back in the day, I spent a number of years on the board of COTA New South Wales, so I've always got an affinity with COTA's work. I'm going to switch on a PowerPoint presentation now and share that with you for just to give a bit of a sense of where we're coming from for today's session. So as Joan said, I wear a couple of hats at the moment. I'm the CEO of Aged and Community Services Australia, the not-for-profit peak body, but we are just in the process of us setting up the new Aged and Community Care Providers Association, and I'm also the interim CEO for that group. I'd like to acknowledge the traditional custodians of the lands on which we're meeting today, as Joan has done, and pay respects to elders past, present, and emerging. I'm going to kick off today where Joan did in the introduction, and that's talking a bit about what the Aged Care Royal Commission found, because I think when you think about the policy settings and what we want to achieve for older people in Australia, while there've been multiple inquiries, as Joan alluded to, obviously the Royal Commission was a high point in terms of inquiring into the sector. And some of what the Royal Commission found was pretty confronting. They found that around 30% of people using aged care services receive substandard care at least once through their trajectory in the care system. And their conclusion was the extent of substandard care in the current aged care system is deeply concerning and unacceptable by any measure. Now, I would point out that, of course, if 30% have received substandard care, it does mean 70% didn't during their time in care. And it's always a challenge for those of us who work in the sector to get the balance right between acknowledging the things that go wrong, but also acknowledging the hard work of our staff in the sector and the many positive interactions that happen between people in aged care and the whole of the system that supports them. When the Royal Commission had a look at, well, why is there this level of substandard care? They very quickly identified a cabinet memorandum from back in 1997 when the Aged Care Act was being introduced. And this is the words of the commissioners rather than the memorandum itself. But that their conclusion was that the memorandum showed the unenviable trade-off around the health of older Australians and a desire to save on public expenditure for that health care being provided. And the commissioners went on to conclude that successive governments have considered aged care as a form of welfare for the very needy to be provided to the bare minimum extent required. And in fact, the Royal Commission found that government underfunding of the sector amounted to nearly $10 billion per annum in 2018-19. And that was 58% of the total expenditure that in that year. And there were two big reasons for the underfunding of the sector. The first was that since the Keating government, there's been a indexation formula applied to the adjustment of aged care subsidies on an annual basis, which has assumed that aged care providers can make basically never-ending productivity gains. And so the effect of that inadequate indexation has been to reduce government expenditure between 1997 and 2018-19 by around 22%. Further, there was caps on the supply of aged care places, particularly home care services, and that reduced government expenditure by a further 26%. So it's a significant impact on the availability of services when you've underfunded the sector to that extent. What the previous federal government did was to respond to the recommendations of the Royal Commission under what they called 5 pillars of aged care reform. This slide will be difficult for you to read in detail, and I'm not going to go through all parts of it given time. But you can see there that there were 5 main pillars that were established. There was home care, residential aged care services and sustainability, residential aged care quality and safety, workforce and governance of the system. And the intention of the federal government was to identify initiatives that would be taken under each of those pillars. So if I take just as an example, the first pillar around home care, there was a commitment to release 80,000 additional home care packages as part of the government's response to that finding about the ration supply that had occurred over many years previously. Those 80,000 home care packages have begun to roll out, and we have seen the waiting list for home care packages fall from around 130,000 down to around just under 70,000 over the last 18 months. So we are beginning to see an improvement in the timeliness of home care availability. However, we've still got a long way to go. So there were then a range of other recommendations, including the creation of a new support at home program, which will replace home care packages and Commonwealth home support services. Now, I'm just picking home care as one example. There were similar responses by the then coalition government under each of these 5 pillars. Well, we've had a look at this from the point of view of the sector, particularly from AXA's analysis. We've added a 6th pillar because you can't provide good quality home care if older people don't have secure and affordable housing. So we believe that housing and retirement living is a really important complementary policy area to the 5 pillars that the former government identified in its response to the Royal Commission. Now, the other thing I should say is, of course, we've got a new government that has made some new commitments, particularly around availability of staffing and dealing with workforce issues in residential care. We're not quite sure whether the new government's plans will adjust these 5 pillars that the former government used for its reforms to the home care, to the aged care system. So we'll wait and see whether they're going to continue to use that basic architecture that was developed in response to the Royal Commission recommendations by the former government, or whether Labor will seek to adjust how it responds to the Royal Commission recommendations. I do want to just conclude telling you a little bit about the new provider association, and in particular what we see as the priorities. So the new provider association brings together the former peak bodies Aged and Community Services Australia, which represented not-for-profit organisations, and Leading Age Services Australia, which had both for-profit and not-for-profit membership. So we will be live from the 1st of July, operating as the Aged and Community Care Providers Association, or ACCPA for short. We will have, at this point we commenced, well over 1,000 aged and community care organisations that will be our members. And we are anticipating significant growth in membership because there's a lot of interest from organisations that weren't ACCA or LASA members in joining ACCPA now we've been created. We're already putting out media releases in the name of ACCPA, and our staff teams are just being set up now to work together in the new interim structure for ACCPA, and that will commence on the 1st of July. So what do we see as the advocacy priorities? Well, the first thing to say is we do believe we need to engage with government, but also the broader sector in what we're calling an aged care reform reset post the election. So we and other organisations made a number of requests of the political parties in the election timeframe, and we've seen the response by the Labor government, which, as I mentioned, is particularly focused on workforce issues. So our initial priorities will be, firstly, to bed down the Labor Party's workforce initiatives to make sure that they're applied in a way that we don't compound problems where workforce is difficult to get by, for example, requiring 24/7 registered nurse coverage, but that's not able to be achieved in a particular country town. And then if you get the settings wrong, you can force the aged care home in that small country town to close. So that's what we don't want to happen. We want to make sure that we're improving the availability of nursing and other care staff, but in a way that doesn't put at risk the provision of services for older people. Second really big issue for us is sector sustainability. So we currently have 60% of residential aged care homes in Australia that operate in deficit. And when you get into the rural and remote areas, that figure goes up even higher. It's 2/3 of all homes are operating in deficit. And even those organisations that are in surplus have seen their surpluses declining for the last 4 or 5 years. So the funding arrangements for aged care are inadequate and are placing service delivery at risk. We saw a number of aged care homes closed in regional New South Wales in the lead up to the election. And I've been talking with a number of CEOs of aged care organisations who are planning further closures of aged care services, both home care and residential care, in the near future. So the funding of the sector has to be right. There will be a paper released by the University of Technology, Sydney, which we, COTA and National Seniors have all been supporting that piece of work. We're anticipating that will be released tomorrow. So that will raise a number of issues about how we could sustainably fund the aged care sector into the future. A big issue for us and for the sector is that the government's proposed changes to home care services, then their proposed supported home program model, we believe is fundamentally flawed. So we are working across the sector and with government to get the government's model changed and ideally a program that supports the provision of community-based services put in its place. rather than one which actually is based on a market-based model, which we believe will place the quality of services that older people need at risk. A really big, important issue that the ALP raised, but has also come up in response to the Royal Commission recommendations, is how can we get greater transparency for the funding that aged care services receive? And that is really important for public trust in aged care. But it's also important that we don't do that in a fashion that takes our valuable staff time away from care. So just asking people to fill in more pieces of paper or online reports and adding that workload on top of what they're already doing, when we know that they're stretched for time to be spending the time with older people, whether that's in people's own homes or in residential care services, we don't think that's the answer. So we believe that technology will play a significant part in achieving better transparency without taking people away from care on the floor of the aged care home or in the person's own home. And finally, all these efforts, workforce, funding, getting the right program structures in place and transparency, ultimately they're all about improving the quality of care. So we have to have that focus on how whatever we do in the sector can improve the quality of aged care services. Joan was talking about it was your father, wasn't it, Joan's experience in aged care. I've got my mum in residential aged care in Hobart at the moment. Had to do all the work to get her transferred from the central coast of Sydney via a respite period before she went down to Hobart, where my brother and sister both live. And it's, you know, it can be traumatic, the experience of entering into aged care. And she experiences, you know, loneliness, times when she, you know, is not feeling very well, so she's in her room most of the day. But the reality was she wasn't coping in the retirement village unit that she was living in beforehand. And that loneliness and isolation would not necessarily have been any different and could have been worse where she was living. And I think that's one of the big challenges, which I'm sure Terry will talk to later about how we can manage that. So I'm going to stop there, Joan, and let you continue on with the program.
Okay, Paul, thank you very much. I think sometimes for all of us that have been involved in lobbying governments over many years, and Paul has, and so have I, regarding quality of care and care options for people, I think when you experience it yourself with a family member, it does actually highlight those things that we think we can advocate strongly for, but then there are still many barriers that stop that really good advocacy. Staffing, of course, as Paul mentioned, is one of them, and the casualisation of the workforce in aged care facilities and in home care, I think, is a huge issue that hopefully we'll see some improvement in. So thanks, Paul. We'll come back to you. So don't go, don't leave us. Thanks for your presentation, and there'll be plenty of questions a little bit later. I'd now like to introduce one of our community speakers. As I mentioned to you, COTA New South Wales, Council on the Age in New South Wales, we run a community speakers program, and we have many fantastic people who go and talk to organisations about issues to do with getting older, aged care, and what the options are. So I'd like to introduce Judy to you. Judy was, like some of us, were in the next chapter of our life, but in her paid workforce, she was a practicing psychologist, having worked in private practice for more than 40 years. As I mentioned to you just then, she's one of our community speakers. Her mum currently is 98 and she lives in an aged care facility. And Judy has become a great advocate around issues in aged care, especially during COVID. She has experienced the system from the other side to Paul. And we're so pleased, Judy, that you can join us today for the discussion. Over to you.
Thank you, Joan. As Joan says, I've been involved with aged care, both in the home and residential care over many years as my parents have aged. And although there are many positives about residential aged care, during the lockdowns, I felt like nobody was listening, and that residents in care facilities were invisible to the majority of people. And therefore, I started to try and raise the profile of issues in aged care within the media. And that took on a life of its own, and along with others working on the same things. Thankfully, many things have changed, but there's still a lot to be done. So from a consumer perspective, what are the areas that have been and still are a problem? Firstly, I think we need a better approach to lockdowns. Secondly, mental health is a big issue. Thirdly, staffing, as Paul was talking about. And also, I think providers needing to let go of some of the restrictions that they've become accustomed to during COVID. So looking at lockdowns, one of the main issues that concerns me as a psychologist is that whilst the physical health of the residents is often well looked after, their mental health is often ignored. And this was especially the case during lockdowns. And we can't sit back and say that the lockdowns are over, because there will always be lockdowns, whether it's for COVID or gastro or flu or some new virus that we don't know about yet. Lockdowns take away much of the stimulation for residents in aged care, and this can lead to loneliness and isolation, which in turn can lead to depression. And depression and anxiety can lead to cognitive decline and dementia. We found that many residents were spending a lot more time in their rooms and couldn't be bothered going outside for exercise, or during the strictest lockdowns, they weren't even allowed to go out of their rooms. In addition, lifestyle programs were often cancelled, as outside people weren't allowed to come in to run them, and residents weren't allowed to go out to community-run programs. We also found last year that many residents were not capable of understanding the situation and would become quite distressed, thinking that they'd done something wrong and that their family were refusing to visit as some form of punishment for them. And that in turn was very distressing for the family as well. So we need to make sure that in the future, when it's necessary to restrict visitors, that these problems are addressed, and that a bubble with a fully vaccinated family member or friend is always allowed, even during lockdowns, allowing them to visit with all the same PPE as the staff. Now, this requires a trusting relationship between providers, staff, and relatives. And unfortunately, my experience is that this is often lacking. It needs to be recognised that relatives pose no greater risk than staff members, and in the vast majority of cases do have the best interests of the residents at heart. One of the things that I have been pleased to see more recently is that some providers of aged care are now taking an improved approach to lockdowns, so that just small sections can be locked down without isolating the whole population in the facility. So one wing or one floor, depending on the layout of that facility. Going on to mental health has always been an issue in aged care. Mental and physical health can't be separated, they influence each other. If we don't look after ourselves, for example, we have no exercise, we have a poor diet, then our physical health will suffer. And then mental health will be worse as well. Equally, if we're depressed or anxious, then we often suffer from poor appetite, we crave foods that are bad for us, we can't be bothered eating properly, and we don't feel motivated to exercise. So it's all a bit circular. And we need to break that cycle by forcing a change at some level. And while medication can sometimes be useful for mental health problems, the first approach should always be prevention and natural interventions. For example, good food, exercise, social activity, mental stimulation. And those are things that we constantly need to be aware of in aged care. Unfortunately, even many health professionals believe that persistent depression is an acceptable and normal response to the social, physical and financial hardships that often accompany aging. But this is not the case, and depression needs to be treated as it would be if they were younger. And in addition, we need to look at those preventative programs in aged care. One thing that a lot of people are not aware of is that residents of aged care facilities are now eligible to see psychologists under Medicare if they have a referral from their GP. This is quite new and only came in last year. As a relative or carer, you could discuss it with your aged relative and then arrange for that referral if they're agreeable. Ideally, you'd be able to find a psychologist who can hopefully visit in the facility and will bulk bill, although I should emphasize that that can't be guaranteed. But I am hopeful that more psychologists will do this as time goes on. It can also be useful for relatives or carers to see a psychologist to learn better ways of dealing with their aged parent or other relative, particularly if that person has dementia or other conditions that make it difficult to deal with them. Going on to staffing, which is the other big issue, and Paul has obviously talked about it a lot. Now that we have a new government, I'm hopeful that more of the recommendations of the Royal Commission will be implemented. The pandemic highlighted the importance of improving the training for aged care staff, as well as the need for better pay and conditions for them, especially if we want them to see aged care as an actual career path and not just something you do while you're waiting to graduate in something different. The pandemic has also led to an even greater shortage of money in many care facilities, as they had a lot of extra expenses such as PPE. As a result of this, and also because of staff being on sick leave more often, there are often less staff per resident, and food standards have decreased in many homes. This could potentially become worse with the current increases in costs of fresh food. And in addition, specialist staff, such as life enrichment staff, often become diverted to the more routine care needs, and therefore they can't do their usual programs. So keeping the pressure on politicians for proper funding and regulation is going to be just as important as we go forward post-pandemic. Looking at the restrictions that have come in during the pandemic, some of those have in some ways been quite convenient for providers. The need to screen visitors before entering has led to doors being locked and therefore residents not being able to go in and out whenever they like. Now, some homes had this practice even before COVID in order to stop residents with dementia from wandering. But now it seems to be more widespread, and I've seen a reluctance to allow free access for residents. This needs to be addressed, as it's an infringement of the rights of residents to come and go as they would in their own home. Aged care residents, by definition, have a limited lifespan, and therefore the emphasis needs to be on enjoyment of life and fulfillment rather than just staying alive. And they need a certain amount of freedom in order to achieve that. Moving away for a moment from residential care to home care, one of the things I always encourage people to do is to apply for assistance well before it's essential. There are many people who have ended up in residential care simply because they couldn't wait the amount of time necessary for the funding for home care to come through. And it was good to hear Paul say that that waiting list has decreased. But I know that my own mum was one of those people who couldn't wait for the funding. She was approved at 95 for the level 4 help, but was told it would be 1 to 2 years before the money would come through at that point. And at 95, you don't really have 2 years to wait. So don't wait until you're desperate for the help. Make sure you apply a little earlier. Finally, keeping a certain amount of independence is so important even after moving into a care facility. And so relatives and friends need to be looking for ways of encouraging this. The need to stay involved with family and friends, and to keep an interest in things that they've enjoyed in the past, even if their involvement is different from the way it was when they were younger. For example, if somebody enjoyed going to concerts and shows or sporting activities, they may not be able to go to those live, but they can still watch them on TV. They may not be able to read books, but they can listen to audiobooks. They may not be able to walk far, but they can still go outside and enjoy the fresh air and maybe walk 50 to 100 meters if that's all they can do. Staying active and interested is so important. And many residents are inclined to stay in their rooms and not want to go out. And that's a bit of a chicken and egg problem, because it often comes from lack of confidence and possible depression. But also, if they stay in their rooms and don't go anywhere, they will lose more confidence and become more depressed. So as relatives and friends, we need to encourage that involvement and activity. Back to you, Joan.
Judy, thank you. Thank you very much. And Judy obviously speaks from her personal experience of caring for both her mother and father. And before this conversation started today, Judy was telling me that her mum seems to be getting out more, and that engagement of even just coming to your place, Judy, and doing activities so that people can actually get through that daily routine. So for some people, they lose notion of what the next day is, because it's like the day before, and tomorrow is going to be like today. So that stimulation, I think, is very important. And if people haven't got family carers and friends to do that, it's very important for facility staff to step up, because as we know, sometimes the physical care can be provided quite well, but it's that emotional and social care that is as important. So it's that whole wraparound of different levels of care.
Absolutely.
Very important. Okay, so let's get through to some questions. There's been some interesting comments coming through the Q&A, and we'll address some of those as best as we can. But let's get Paul back with us. And and the first question, Paul, I think might go to you. I think you've seen some of the comments come through, especially regarding people in rural and remote areas and the difficulties of getting staff. And so I might start with that question myself, because, all of the Council on the Ageing organisations, we get together regularly, and we're having this big issue at the moment of people in aged care facilities not being paid the same amount as people providing aged care within a hospital setting, or whether it's public or private. And there's so much casualisation of staff within aged care facilities that, to me, the staffing levels are really, really important. And how is that going to be addressed for people in rural and remote areas, I think is a question that we'll start with.
So the first thing to say is that the workforce challenges in aged care predate the pandemic, and hence, the Royal Commission's focus on those challenges. And some of the longer term issues include wages, career pathways, training, which Judy mentioned that is a major imperative for us to do better. And of course, the other factor was that we've relied fairly substantially on overseas people to come and work in the aged care sector. And indeed, there has been in some evidence of a reluctance of Australian-born people to work in the sector. Now, that's probably linked with pay rates and some of the other challenges. So what happened with the pandemic was that everything just got considerably worse. So you had periods, particularly December through to February this past year, where you had the pandemic with Omicron wave at a high point. We were having anywhere from 30 to 50% of staff off at the one time. And you can imagine what that did for the quality of care of older people. It was a really tough time. And all of the issues Judy raised about access into aged care homes, we can pick them up the detail of them a little later, but they were underpinned by a lack of staff. There just wasn't enough people there to actually facilitate families coming in an easy fashion. So it really has been very, very tough with the impact of the pandemic, the closed international borders and the like. And of course, it's not just aged care that's been affected. Every sector of society and the economy has had an impact from lack of staff availability. To get to the crux of your question, what's it going to be like in rural and remote areas in particular? Well, we know that recruiting particularly health professionals, so registered nurses, allied health professionals into country towns is tough now. It's not only tough for aged care, it's tough for the broader health sector. In fact, just as we've been meeting today, an email popped up, the New South Wales government's announced another package to try and help recruit health professionals into regional parts of New South Wales. So aged care will be competing with the public sector to try and attract people into those country towns. Some of the answer is the wages. So the outcome of the current Fair Work Commission aged care work value case will be really important, and the ALP's commitment to fully fund that is very welcome. But it's not all about wages. We will need to improve the availability of mentorship and support for people as they come in and to work in the aged care sector. We do need to improve the career pathways, and we need to provide the support to aged care staff, but be that in terms of, employee assistance programs, internal work that aged care providers do around staff culture, HR support and the like. And often for those smaller organisations in country towns, that can be very difficult to provide. So it's a complex issue. The commitments from the ALP are a really good starting point. So we're looking forward to working with them to establish how we can improve staff levels across aged care, home care and residential.
So Paul, just on that last comment that you made regarding the new federal government, do you think they have signalled to you, and they've only been in power for a very short period of time, but do you get a sense that they're more focused, there'll be a more focused approach to ageing and aged care?
Look, it is very early days. So I had my first contact with the office of the new Minister, Annika Wells, who's got the aged care portfolio only a couple of days ago. So it will take some time for us to see how the ALP works through its priorities, the connection they have. I know Ian Yates on behalf of COTA met with the Minister last week. So we've started the engagement as a sector with the incoming government. And we'll obviously be looking to take forward the priorities that I listed from the point of view of the aged care providers. Ian's obviously had an opportunity to talk about the priorities from the consumer viewpoint. So we will be keen to have a good relationship with them. I'm, at this stage, positive we'll be able to achieve that.
Well, we always know, if we've been around, Paul, as long as you and I have, that you get in early and you try and influence from the very beginning so that they can actually put a stamp on
That's right.
an improved aged care sector. Judy, over to you. I think one of the approaches of the new Labor government, well, according to its policy position, is to put security, dignity, quality and humanity back into aged care. From your perspective, how do you think this is going to happen, and where do you think the focus should be?
You can't do any of those things unless you have the properly trained staff and you have sufficient numbers of them, so that residents can then be treated as individuals, which is what you want in that setting. There's currently, it seems, no consistency throughout aged care in the training that's needed for carers. And one manager once said to me that some of the carers she had coming in had barely more than just a love of old people. Now, that's great, but you need more than that. Some of them, it seems, had some minimal training that involves all the physical things like how to lift people and so on, but no training in any of the more complex needs of this population. So I think that's really important, to make sure that the carers are trained properly so that they can provide that more individual caring for the residents who are in there. You certainly can't get any of those things like security and dignity, etc., unless you have good staff, and they're very willing, and you know, they're hardworking, but if they haven't been trained properly, then that is a huge issue. And I think there also needs to be more of an emphasis on lifestyle and enjoyment of life rather than just keeping them alive, which became a real issue, particularly during COVID. And I remember my own mum said, you know, I've got to die of something. I don't care whether it's COVID or something else. I just want to go out and enjoy myself, which I think a lot of people would have agreed with her.
Mm-hmm. Well, the same with my father, Judy. His physical needs were pretty well met. His medical needs were met. But the thing that he missed so much was just that daily contact with people, to share a funny story. He was the best joke teller in our family, and he would tell the same jokes over and over again. And that's when he used to say to me, sweetheart, the days are so long. If someone could sit with him, and that needed to be on a daily basis so that he could share those jokes. And some of the staff would have done that, but there were not enough people to do that.
No.
And that would have made a difference to his dignity and quality of life.
I think it's really important on this one to remember that, particularly in a residential care setting, different older people and different family members have quite strongly opposed views here. So there was a very strong theme early on, so going back to 2020 when the pandemic first started, of older people who wanted closed doors, who wanted people not to be visiting. They were afraid of catching the disease. And there was also, particularly from some family members, this: you must protect our people at all costs. So aged care providers were a bit the meat in the sandwich, because you had different opinions from different people. And you also had the health authorities who dictated a large part of what Judy described earlier as the lockdown measures. So you had public health units who were telling aged care providers, look, you've just got to lock the doors. You can't let anybody in. You can't let people move around. Forget about people with dementia who wander, or the rights of older people. And so we and COTA and others really put some pressure on through the second half of last year to get that shifted, because exactly as Judy described, there was this protection kind of overlay, which sometimes was coming from the providers, sometimes it was coming from the families, and particularly it was coming from the public health units. And so the government, federal and state, did make some decisions in the early part of this year to change the approach. And exactly as you described, Judy, that issue of, can we lock down any small parts, you know, kind of, that became the advice that was given to the public health units and in turn onto the aged care providers only in about February. So, yeah, it has changed, thankfully. And you're quite right, Judy, the impact on mental health of older people, and actually on the families too, of being locked away from their loved ones, was really significant. I mean, I missed my mum's 90th birthday because it was locked down at the aged care home at the time, because I couldn't fly to Tasmania from New South Wales. So there were big impacts on people, and thankfully we've got a bit more of a balanced approach now than we had through the first year and a half of the pandemic.
Yeah. And I would be the first to agree that in the early stages of the pandemic, there really wasn't any choice but to lock them down, because there was no protection from the disease. Once they'd all been vaccinated.
Have vaccines, yeah, that's right.
Yeah, but now that they've all been vaccinated, or at least had the chance to be vaccinated, then, you know, really, I think we need to look at different ways of dealing with those lockdowns.
And I think, as we've sort of been highlighting, it's the loneliness, and I think when people at the last stages of their life, they're dying alone without family members. I mean, to
Yeah,
me, that's a tragedy in so many
yeah,
ways. We know it's a complex issue, Paul, but from the perspective of providers, what do you think will make the system work? We've talked a bit about the casualisation of the workplace. You've talked about the injection of some more home care packages, which came through in the last budget. But we have to make sure that people don't have to wait so long for care. I guess that's the big issue. That's a staffing issue. It's a government funding issue. What will it take to make sure that nobody waits longer than 1 month for care to start?
Uh, the the answer is the two things you mentioned: more staff, more money. So the investment in those 80,000 home care packages that I mentioned earlier is clearly a good thing. What we've hit in the last few months is we've hit the capacity of the home care providers to actually have the staff to provide the service. So we've got a supply side capacity issue, and it's a workforce one. So the government can release more funding. That is helpful. It has reduced the waiting list, but we're nowhere near the 1 month yet as a guarantee of service. And we actually have to attract more staff in order to be able to do that. So that issue of improving the wages of aged care staff so they are competitive with other sectors is really critical, I think, to be able to address this issue. And then the second thing is getting the funding system, the program settings. That's why I mentioned earlier the changes for the Support at Home program. It is important that the government sets up a replacement of home care packages and Commonwealth Home Support programs in a way that actually works properly and ensures that we have continuity of service for older people. Just in terms of casualisation, it's an often stated issue. In fact, the majority of aged care staff, by quite a long way, are permanent employees, but they're often part-time permanent. So there is an issue, and aged care providers do need to do better in terms of offering more hours of service. But you've got to remember that part of our problem is you give older people more choice about who they want as their care worker. That actually tends towards a need for more casualisation or lower amounts of guaranteed hours. So choice for older people is often a trade-off against the staff's ability to be employed on a more permanent basis.
Well, let's continue that line around staffing issues, Paul. I mean, the Labor Party, you know probably more about this than many of us, but have committed to a registered nurse in every aged care facility 24/7, as well as increasing the average amount of care to 215 minutes a day. But how's all this going to happen when we've just been chatting about trying to attract people into the sector? We've had some comments from a lot of people who live in rural areas, and there's no way they can't even get enough health staff, for the health system, let alone attract them into an aged care facility in a smaller place.
One of the positives of aged care in rural communities is it's often one of the largest providers in the town of work. So if properly funded so that you can recruit additional staff, there is the potential, because they're one of the larger employers for, in particular communities, for us to attract more people to come and work with us. Then there's the issues that Judy mentioned earlier about making sure they're trained appropriately and so on. But I've been saying now for a while that a number of these things need to work together and be happening concurrently, otherwise we won't solve the problem. So you need to have the wages boost. It's critical. If you're not going to attract people in the first place if you can't pay them adequately. We need, in the short term, there to be some relief in terms of opening up capacity for people to come from overseas to work in the sector. We know that the pandemic border closures have really accentuated the availability of staff problems. And the ALP has come in acknowledging that they're going to need to do that. And Annika Wells, in some of her first statements, has talked about the importance of working out how we can get some people in from overseas, at least initially, to break the back of some of the backlogs of care staff availability. And then the third thing we need to be having happening at the same time as the other two is the funding mechanisms, the rules around the additional funding to allow 200 care minutes and then 215, the 24/7 registered nurses, the additional home care, all being set in a way that facilitate us improving the availability of care hours, but not penalising providers for failing to meet them in a way that would actually jeopardise the delivery of the service. And that's the particular risk for the small country towns. 80% of aged care homes in Australia now have 24/7 registered nurse coverage. So we're only talking about the other 20% in terms of achieving that goal. And they're nearly all in country areas. So that, you've got to say, well, why don't they have it already? And it's an availability issue.
Yes. Yes.
So you've got to be very careful to say, okay, there's a new rule going to be coming in. Well, let's make sure that new rule doesn't force the aged care home in, Cowra to have to close.
And there seems to be a bit of a trend with some aged care providers of really getting people out of retirement. So people who are really interested in keeping working, and especially for older women where their superannuation mightn't be that crash hot, and they sort of think, well, how am I going to survive the next number of years, that I don't want to have a quality of life, that are entering back into the workforce and working in an aged care facility or in the broader aged care system is, I think, is one area that might allow more people to get back into the workforce with, again, as Judy said, very appropriate training. Judy, just a question for you. You mentioned consumer-directed care, and of course we know that that doesn't always happen on the ground for all the reasons that Paul's spoken about and that you have spoken about. What are your experiences? I mean, you are a strong advocate, so I'm sure you'd make lots of changes to the care for your mother, but what are your experiences with consumer-directed care in the facility that your mother's in?
I guess most of the issues that I've seen there really come back to the fact that there's not enough of the staff. And so, the staff that are there are fabulous. They're devoted to their jobs. They're devoted to the residents. They're really keen to do the best job they can possibly do, but they're totally overworked. And so they can't give the amount of attention to the residents. One of the other issues that I sometimes see is that, and again, it probably comes back to not having enough staff, is that a lot of the activities that are run for residents by the lifestyle people often tend to be geared to the lowest denominator. So, people who are more mentally capable there are invited to go along to sort of craft activities and social activities, which, people like my mum, who are mentally pretty good, sort of say, well, I don't want to do that. It's like some kindergarten activity. So they need to have activities that are geared to all the different levels. And I guess when they're short-staffed, the ones from their point of view that are the most important are the ones who are at that lowest level cognitively, and you leave the ones who are mentally more capable more to themselves, and I hope they'll join in with some things or do stuff of their own volition. So I guess there's that need for looking at all the different levels and saying, well, what are some of the things we need in this place, or how can we bring it in from outside, or how can we get them involved in outside groups if they can't provide those activities there. Because for a lot of them, they'd be perfectly happy to go to other outside activities. They just need the transport to get there, because they're not able to sort of walk out and catch a bus. Yeah, so gearing things to different levels, I think, is really important.
Well, let's go back to the workforce issues, Paul. I mean, you've talked about meeting with the aged care minister and the idea of getting more people from overseas and hopefully improving the whole visa system. Any other ideas that you've got about increasing the numbers of people that can be attracted into the aged care workforce, both for home care and residential aged care?
I think the only other thing I'd add, Joan, because probably the key things about wages and the support when people arrive through mentoring programs and so on. There's a question in the chat about, you know, who actually provides the training and do we need more training places available? And of course, for health professionals, it's via universities. So, numbers of registered nurses, allied health professionals will be driven through the availability through the university sector. But the majority of aged care staff are through vocational education training, Certificate 3 or Certificate 4 level training. The majority of aged care staff now, anywhere between 60 to 80%, do have Cert 3 or Cert 4 training. And that's even with the turnover rates that are quite high. So we've always got people coming through those training programs. But what was found both through the Royal Commission and in other places, and it's certainly the experience of aged care providers, is some of those qualifications are, not to put too fine a point on it, not worth the piece of paper they're written on. They're just simply not in depth enough about the issues that staff are going to actually experience when they start working. And there were, certainly a couple of years back, there were courses you could get in 6 to 10 weeks, and that's simply not enough to understand what you're going to be facing in aged care. So I think the quality of the registered training organisations and the programs they run will be very critical. So we are already working both with the Aged Care Workforce Industry Council and with the Human Services Skills Organisation on ways in which we can improve the training models that are available in aged care. But it's a much bigger issue because you're then dealing with the TAFE and the registered training organisations and the universities.
Okay, now Paul, I'm just going through the Q&A here, and there's a question about spot, the quality checks. Can you just talk a little bit about that? And are the spot checks without notice? How do they ensure the standards are being met?
So the Aged Care Quality and Safety Commission is responsible for regulating aged care services and their compliance with the aged care quality standards. So the Quality and Safety Commission, well, leave COVID aside because COVID changed what happened on the ground quite substantially. But in principle, at least, the Quality and Safety Commission visits annually, unannounced, to every aged care home. And that's at least once. They might go more often if there was intelligence that they felt they needed to go and check in more detail or for a second time. Then there's an audit process, which is more detailed, and that's a maximum of 3 years. Again, can be less depending if there's been problems identified. The audits used to be announced, but in actual fact, now they're not announced. You don't know what day the audit is going to happen, but you do have a roughly 3-month window within which they're likely to happen because that's the length of your term of your accreditation. So some people very erroneously keep claiming aged care providers know when the Quality and Safety Commission is going to visit. There are occasions when the Commission will contact a provider and say, we are going to come and we're going to be looking at this particular issue. And they did a bit more of that because of COVID and not wanting to turn up when there were outbreaks and so on. But by and large, aged care providers do not know when they are coming. and the Commission has carte blanche to come pretty much at any time.
Okay, thank you. Now, Paul, I know you're going to be leaving us soon, but there's just a couple of questions here that have come through directly to you. This is from one of our life members, Val Fell, and she says, in one rural town, a provider of NDIS services were not able to continue, so they merged with the Metropolitan Aged Care provider, and they formed a co-op providing both services. As members of the co-op, the carers stayed in town. They used technology to keep communication with each other at correct levels. Do you know anything about this sort of model? Is a question to you, Paul.
Yes, Val, I do. So we have been supporting the cooperative peak body, who's actually received some funding in the last federal budget to look at rolling out models across disability, aged care and health of cooperative arrangements in country locations. So we'll be supporting that work. You're right, Val, there's been some examples already in country towns of co-ops being developed. Now, co-op could be run by the staff, it could be actually run by the consumers, or just by local community groups actually coming together to work in that area. So it's really important that we look at a range of different models of service delivery into regional Australia, and we'll be very keen from Aged and Community Care Providers Association to be working with the Cooperative and Mutuals Association to see how those models can be adapted and run out into aged care and other services.
And while you're still there talking, there's another one that's just come through, Paul. This person says, could you explain your concerns regarding the proposed support at home program?
So the government's model for support at home, and bear in mind they are, they've got a new set of ministers. They may well be going to change this, but the paper that was released in January that outlined the Department of Health support at home model was based on a payment platform being introduced, which would allow both older people or providers to be able to arrange individual services. You'd be assessed as to what level of services you could potentially use. And it was very much a financial transaction model, and the government was explicitly saying we're going to lower the requirements for so services could come in. They wouldn't have to comply with the aged care standards anymore. They would be able to come in and register to provide services through this payment platform. Our view of that model is that it is inimical to the interests of older people. It's contrary to the Royal Commission's recommendations, which were about moving away from market-based models. We've put forward an alternative model that would see an extension of the funding system that is to be introduced for residential aged care across community-based settings, and would enable payments to allow capacity for community-based services to continue to exist in local regions and be able to provide services older people actually need.
Mm-hmm. And just a couple more, and then I'll go back to you, Judy. Paul, what about the issue of immunisations not mandatory for staff, COVID immunisations and flu? I thought they were, no?
COVID has been mandatory in most states. Some states with the moves now to be a bit more open are removing requirements for aged care COVID vaccinations. Flu vaccinations, they were made mandatory in 2020, but they weren't mandated last year, and they haven't been mandated by and large in most jurisdictions this year either. But obviously with the influenza actually spreading again in Australia this year, all aged care providers are working to make sure their staff and wherever possible residents are getting flu jabs.
Judy, you talked a lot in your presentation, and I'm just reminding all of the people out there that you are a psychologist and you do have concerns about the mental health of people in residential care. You did talk about changes to the costing of psychology services or services by a provider in that space. Does everyone know about that? I hadn't realised that that was now available, so that's a good thing. But just explain a little bit more how that works.
Okay, so anybody in the community, if they want to see a psychologist and they want to be able to claim some of that back from Medicare, the cost, then they need to get a referral from their GP. In the past, that wasn't available for people who were in residential care up until sometime last year when it changed. And so that meant that basically they either had to pay full price, which they might be able to get back off private insurance, but if they didn't have that, then they were just out of pocket. Or they were relying on the provider of the residential care to provide those sorts of counselling services, which most of them don't, because they wouldn't be able to afford to. So now, even if you're in residential care, you can get a referral from a GP and can see a psychologist. Now, some psychologists will charge a gap fee. Others will bulk bill if you're on a pension, particularly. But, you know, that can't be guaranteed. Obviously, everyone has their own payment system. And so you can get, it has been, I think temporarily it's 20 sessions per year that you can get under Medicare. And I think that is still hasn't been changed again, but that was brought in, the extra sessions were brought in during COVID, and I think they've maintained them this year.
And do we have enough psychologists to provide?
I guess there's always a shortage of psychologists. And also, unfortunately, there's not a lot who have become accustomed to working in aged care. So I recently on a Facebook page with psychologists put out, you know, are any of you interested in this sort of work? Because it would be interesting to have names to give to people in different areas. And I got very little response back. However, that doesn't mean to say there's nobody out there wanting to do that. And so it's just a case of looking and asking GPs for a referral.
Paul, just before you need to leave us, we have talked about a whole range of things regarding putting more funding back into the system, because we know that aged care does cost a lot of money, and we know that many people would probably be willing to pay maybe more taxes so that we get a system that isn't one of neglect, but a system that provides high quality care, and that's what we all want. So how do you think we can achieve a balance between taxpayer funding and user contributions?
So the first thing to say is there's three main sources of funding for aged care. And it's really important everybody understands it, because often the discussion goes off on tangents which, you know, assume there's a large sums of money sitting somewhere else, which in most cases there's not. So the first main source is government. So around about 75 to 80% of the funding of residential aged care comes from the government. It's around 90% of the funding of home care and Commonwealth home support comes from the government. And then in terms of the buildings in aged care, the government provides a lot less, but does provide funding which supports the building of new aged care buildings, particularly capital grants for rural and remote services. And it provides funding that supports full pensioners who don't have assets to live in aged care homes. Second big source of funding is what users pay. So it's roughly 30% in residential care. It's roughly 10% of home care costs are paid by the people who use the services. And then third is the other sources of funding which aged care providers can bring to bear. So in some instances, that's bank loans or other capital, which is largely around the buildings rather than ongoing operations. And then, of course, some community groups can raise donations and other funding from their local communities, be that an ethnic community or a regional, community. That contribution, particularly from donations, is quite small as a total, the whole of the sector's funding. And most aged care providers do not have large amounts of money sitting in the bank. Some do, but most don't. So the majority of the day-to-day funding really is coming from consumers and government. So then the question is, okay, what's the best way in which we continue that funding and improve it so that we can improve quality? And as you said, Joan, that is where you get the discussion about, well, what are the models? The Royal Commission found that they did some research and found that people were actually prepared to support an increase in taxation to improve the quality of aged care. And indeed, the commissioners made a recommendation that there should be an aged care levy similar to the Medicare levy to improve aged care. Interestingly, both the Coalition and the ALP have refused to consider that recommendation. So if you're not going to do that, then you have to look at, are there other models such as social insurance models or other long-term fixes? And can you improve for people who can afford to pay, the way in which they have options to pay, for example, for optional services that might be on top of the normal services which are government funded. So they're the sorts of things that the paper from the University of Technology Sydney, which will be out tomorrow, as I mentioned earlier today, that will be a key thing. Megan, I'll drop you a link to that when I know when it's up on the UTS website so that you can make that available to COTA members.
Well, Paul, we thank you very much. We know how busy you are in this transition into a new organisation, but we do wish you all the very best with the merger, if that's what, in inverted commas. It's good to have you in charge of things or leading some of that change that is required. And COTA New South Wales, as well as other COTAs, we look forward to working with the organisation in the future. So you take good care of yourself.
Thank you, Jane, and thanks everybody. It was a pleasure to be here, and sorry I have to head off and do some other work now, but all the best for the rest of the session.
Thank you, and we wish you all the best with your mum's care as well.
Thank you.
Paul's just going to leave us, folks, and Judy's going to stay with us, and we now introduce Terry, one of our COTA New South Wales staff, and we call him a bit of a guru regarding aged care navigation. So Terry, it's great to have you with us, and you are the team leader of our Aged Care Navigator program, which is funded through the federal government. Terry is a speech pathologist by training and has worked as an ACAT assessor before joining us last year. He has a wealth of knowledge about aged care, and he's here to share it with you. So Terry, would you like to make a few comments? And we've got a couple of questions that have come in to get us kick-started, but tell us a little bit about yourself and your issues.
Thanks, Joan. Great to be here. Thanks for having me. So I did join COTA New South Wales as team leader for Aged Care Navigator last year. And as Joan said, it is government funded, and it is anticipated that, it is going to inform the Care Finders program, which is set to be implemented in 2023. So what I do, and my small team of navigators, there's myself and my colleague Caleb, is we assist people to understand the aged care system, help them navigate the aged care system from the beginning of the aged care journey or in the middle, wherever. It could even be a simple request such as registering with My Aged Care or help with registering with My Aged Care. Also, understanding the different types of assessment, potentially even being present with them during assessment, understanding the paperwork, helping them fill out forms, and also, and most importantly for many people, assisting them with finding providers. And in particular, people who may be isolated and not have any formal or informal supports at home, so they may have difficulty engaging with any organisation. They may need that extra support and have that sort of extra support person which we can act. Yeah, so that's a little bit about our program. So I'm happy to take any questions. Do bear in mind that navigators are not sort of trained financial services experts. I can answer the basics and I can cover the basics, but any of the nitty-gritty when it comes to the financial aspect of entering, in particular, an aged care facility, I can sort of refer you on to financial information services.
Okay, Terry, well, just for the people who are still with us, and we've still got a lot of people who have hung in there with us, so that's fantastic. So if you've got specific questions to Terry, just put them now in the Q&A. But Terry, we've got we've got a couple of questions here from people who couldn't join us today. So let's start with this one. This is from Catherine. With two parents requiring services, how will services be charged and catered for? I appreciate that home care packages are specific to the individual, but with both parents having early stage dementia, they both require support with different things. Are support workers able to provide joint care in these situations? Beyond this being at the provider's discretion, are there specific home care programs which cater for more than one service recipient during the same visit?
Yeah, this is quite common actually. Quite often the couple do require support in their own way, both of them, and this starts at the assessment process. So it could be they are both approved for support at the same time with a double assessment. I know that in my time as an ACAT assessor back in the day, I often had a double assessment booked for a couple. And it is always, even though you assess them as a couple and the services are delivered individually, so both will get an individual support plan. And I suppose it is at the discretion of the service provider in how that's delivered. I do know that quite often, if there is, it all depends on staffing as well. If there is adequate staffing, then the same person can attend to both. One example I have is let's say one of the couple has a service in the morning, and it could be personal care, or it could be the domestic assistance that's in that person's name. That worker can then stay on to assist the spouse in whatever service they need. That could be individual social support, taking them out shopping, or even doing personal care for them as well. So whilst they can be sort of doubled up in terms of the support worker coming out, it's not always the case. It really depends on the service provider and the staffing available. It's certainly possible. Now they are, as far as fees go, they are charged individually to their own package. But my advice is certainly to sort of discuss with a provider, and really at the support plan phase and implementing that support plan, it should be a collaborative approach and a collaborative process. And this is where you ask the questions, and quite often it just is more practical for it to occur with the same worker, sort of one after the other.
Okay, thank you for that. This question is from Anne-Marie, who has a range of medical conditions requiring the use of home and portable oxygen. She's had an aged care assessment done, knowing that the wait time is going to be between 12 and 18 months, but was told she wasn't eligible for assistance at this point. Given the deterioration in her condition over the last 12 months, she's really fearful that by the time she's approved for a package, the wait time will mean that she won't be able to get the assistance she needs when she needs it. Is the policy to wait until a person is desperate for care before letting them apply, knowing that they will struggle during a wait period?
Yeah, I definitely, I had a read of this yesterday. I've actually gotten back to this person individually, but I'll address it for the group as well, just in case anyone else has a similar situation. What actually happened with this person is that they were assessed and were approved. They just weren't approved as a high priority. And what the assessor had mentioned was that it would be about a 12 to 18 month wait for this person's high level package. And that's a very long time, as we know, and that's just something that could potentially be reduced if the case is put through as a high priority. So what I had advised this person was that there's several different avenues they can go down. One is getting a written letter from their GP or a specialist explaining how their medical condition can affect them and how their function has deteriorated in the past 12 months. This can be a letter of support. It can be provided to the assessor as a supporting document to help put the request through as a high priority. The person can contact My Aged Care to request a reassessment as they feel that their needs warrant an approval for a higher priority. In this situation, with what this person had advised us, is that you'd think that this could warrant a higher priority case. So I also suggested OPAN, which is the Older Persons Advocacy Network. So they're a peak advocacy service and would be best suited to assist them and advocate on their behalf. So if all else fails, I would recommend contacting the Aged Care Quality and Safety Commission if you're not satisfied with the outcome, and you're able to lodge a complaint with them. If you're not satisfied with any decisions made, read that application. But I do encourage people, if they're not satisfied with the decision that's made during the assessment, they can take that further. I do recommend advocacy networks. We're not advocates as such, but going through either Seniors' Rights Service or OPAN, which is the Older Persons Advocacy Network, they can assist and help them sort of act as a voice and sort of fight for that decision. I think in a situation like this, when it comes to deteriorating health and oxygen supply, one would think that that would be warrant, that would go through as high priority. Yeah.
I'm just having a look through our Q&A here. There's lots of questions, and folks, if we don't get to them, we've still got half an hour, so we'll get to as many as we can. But you can access them too, Terry.
I did have one. Sorry, John. There was one that
I
said I'd address. It was from Corinne, who mentioned, are there professionals like financial advisors who can assist families with the finance, aged care facilities, decision making, etc.? What are these people called and how might one find them? So the Financial Information Services at Services Australia, they're the financial experts, so they can assist with going through sort of income tested care fees, filling out those forms, understanding the fees associated with entering aged care. And as I said, we can sort of answer sort of basic questions and basic information over the phone, but Financial Information Services are the experts. The phone number to call them, I can actually put that in the general chat. So I'll put that in right now. So Financial Information Services officers are with Services Australia, and you can contact them on 1-800-227-475. I've just popped that in the chat there. Yeah.
There's one here from Shirley. I'm 75 and in reasonably good health, but my abilities to do things around the house now are getting harder. how soon should I apply for home care? Good question.
It's always, yeah, it's a really interesting question, Shirley. My advice is to just get in the system as soon as you can. You know, it's a personal decision, of course. And what I would recommend is giving My Aged Care a call. You can answer a few questions that they'll ask you, known as screening questions. And my advice to people always is think about, when you're answering questions about your function and daily living, always think about your worst day. And that can help inform sort of services you may need in the future. But it's great to hear that you're in good health, but it is also, you know, it certainly doesn't hurt with getting registered, which will save time in future if you need it. It doesn't necessarily mean that you will require an assessment straight away, but you're actually in the system, and contacting My Aged Care would be my recommendation to get sort of your foot in the door, just to sort of save that time and hassle further on down the track.
I think that preventative notion is a really important message. Now, there is a question here too about accessing ACAT. And this person was told that they have to go through MyGov, My Aged Care.
Yeah.
They live in Wollongong, and they're still active and very aware at 90. But this man says his wife is becoming less mobile and needs more attention. I need to eventually find my way through the MyGov gateway, as mentioned. Let's have a bit of a chat about that, because I know for some older people that is a real issue.
Yeah, and this is how, sort of why we exist in this sphere. We can help you, Warwick. You're welcome to give me a call and I can help you individually. What I'll do at the end of this portion is put up my contact details as well, which will enable you to contact me. You do need to go through My Aged Care for all assessments. There are different levels of assessment. You have your sort of lower level supports, which are catered to by the Regional Assessment Service. So they can approve for sort of single services around the home, whether it be domestic assistance, could be personal care, it could be transport. The higher level assessment is ACAT, the Aged Care Assessment Team. And they're the ones that can approve for home care packages, for residential respite, for permanent residential care. And in order to get those assessments, a registration with My Aged Care is needed, and then an assessment is booked. Now, I won't go into too much about the reforms for next year, but there is proposed to be an integrated assessment process, which will make it less confusing for the general population. It'll just be a one-stop shop. But once again, it'll be through My Aged Care. So, Warwick, I recommend you contact me and I can assist you with sort of navigating that system and that pathway. I will pass on my, share my screen soon, and I'll pass on that contact details.
Now, Terry, is that the same question here about Mrs. Warwick? They don't recognise his birth certificate from Wellington, New South Wales.
That's interesting.
Right. So this says, how do you get through My Aged Care when they block any IDs, after driving license and Medicare? They do not recognise my birth certificate from a place in New South Wales. And he's just...
I haven't come across this before. I probably need a bit of time to sort of investigate that one. So Warwick, once again, I encourage you to contact me and we can go through that. I haven't actually come across that before. Yeah, I can't see why that would be a block, but that could be some bureaucracy that's difficult to navigate. So we can actually go through that together. But once again, I haven't actually come across that, so can't really give a comment on the fly with that one.
And there's one just comes through, Terry, that you'd see about a person whose 96-year-old mum has gone through the ACAT assessment, and they were told there was one assessment for at-home care and a separate one for residential care. Is that correct?
No, so what it is, Kerry, is there are two levels of assessment. Sometimes a person doesn't need both, But with the ACAT assessment, they are equipped to approve for 3 programs. So the home care packages program, permanent residential care, and residential respite care. So they're the higher level assessments. So that's the ACAT assessment. With what's known as, well, at-home care, I suppose it's called the Commonwealth Home Support Program. And that is the lower level single services, sort of single access services. It could be domestic assistance, transport, Meals on Wheels. They're assessed for by what's known as the Regional Assessment Service, RAS. And they're the ones that assess for those more simple home care services. With ACAT assessment, they can cover an assessment for residential care, and they can also cover an assessment for a home care package. They also can approve those single services also. So the ACAT is really at the top of the tree, and they are able to approve all of those programs. So it may be some wires crossed there with that one. So judging by the question here, your mum was assessed, and really, if she did have an ACAT assessment, she'd be able to access all those programs based on approval. Kerry, I'd encourage you can give me a call. Once again, I will put my details on screen soon, and we can sort of cover that further. I also wanted to say, Joan, I did notice a question in there by John, who mentioned self-management of home care. Yes, you might have been.
I was just about to cover that one. No, that's okay. And also the one below, I think.
Yeah. That's really, well, it's quite popular at the moment, John, because as we know, service providers, you know, they have different sort of fee structures. It's, you know, package management fees, case management fees, and this can sort of add up. And not to mention some issues with rostering and finding appropriate support workers or the same support worker. So many people are actually calling me and asking me questions about self-management. There are some providers who offer self-management. There's pros and cons to that. It means that you do eliminate many of those package management fees and whatnot, but it also means that it's a lot more work for you or your carer or family member. There are pros and cons. COTA New South Wales does have a toolkit and a guide that can sort of, you know, it's great reading. It's really well done. I have sent that out to many people who are considering it. Not all providers offer self-management, but with the reforms due next year with the Support at Home program, it will be more self-management friendly also. I encourage, once again, contact us. We can send you the toolkit and the guide for self-management. It really can help answer many of your questions and just give you an idea of what it entails. And, you know, it once again, it does look, all providers also are obligated to offer a support person. So even though you are self-managing, you still do have that contact person that can sort of be available for any questions. But self-management is becoming quite a popular question, and it's also becoming quite, popular mode of service delivery. As you know, some people are getting, a little bit. There's a little bit of angst with many providers out there at the moment.
And Terry, to see the one from Colin, I think that's it's, if you read through it, it's just that whole issue. They need some basic support, but they have been told they won't be able to get help for over 2 years. Is there anything else that they could do? So it's a couple.
So from Colin, so Mavis, yes. So you've registered with My Aged Care. And sorry, I'm just having a quick read of this. Okay, so they've advised that any help for well over 2 years. What it sounds like is that the home care package may take up to 2 years to come through. I imagine that would be for a high level package, which is level 4. For those who don't know, home care packages come in 4 different levels. There's the lower level 1 and 2 and the higher level 3 and 4. 4 is the highest. When I was an ACAT assessor, my last stint in that role was about 5 years ago. The time for a level 4 was up to 2 years. Since my time doing assessments, the government has released more packages, but, the wait time is still quite astronomical. And one way to sort of get around that is if you can advocate for yourself or find someone that can help to advocate for you to be put on a high priority list, depending, as I mentioned earlier, depending on your function, your medical condition, and the urgency of that. So, it may reduce some months from that wait list, but yeah, it's really quite dependent on the landscape of the time, and the national queue does sort of fluctuate. The national queue is what you're put on after your assessment, and obviously the higher priority that you are, the quicker you could get it. In the case of, if there's anything else you can do, they can offer you a lower level package while you wait. So if you're approved for a level 4, it may take that long for it to come through. You can actually access a lower level package when that becomes available, and that's generally between 3 to 6 months, sometimes quicker. And you can get some support, not all the support that you've been approved for, but just an interim level package until that higher one does come through. So that's one option. Another one is, and this doesn't apply to everyone, I know, but sometimes if you have the means to go private, which not all of us do, yeah, one of the sort of band-aid solutions at the moment is those interim lower level packages, which is available to all who are approved for those higher level packages, and your assessor should have run through that with you.
Just on, there's another one here that I didn't get through during the beginning of our webinar when Paul was around, but the question is, what happens when someone on a level 4 ACAT and has got obviously many disabilities runs out of money for care hours?
Yeah, this is a tricky one. This is something that really should be discussed at the service agreement phase when you sort of enter into that agreement. I imagine that many of those funds may have been sort of used up for equipment, sort of assistive devices. I'm not sure, I don't know the situation, but this is something that you would need to discuss with your provider. And yeah, it's a really individual sort of situation, that one. It's not common that fees are sort of exhausted. Unspent fees are sort of rolled over, but as far as exhausting the fee allocation for the year, it's not something I've come across too many times, but it is something that you would have to negotiate with your provider. I do know that next year, and look, this may not be of any help to you, and I don't mean it to sound condescending, but for next year, when the Support at Home program rolls out, there will be sort of different approaches to how sort of equipment and things like that are rolled out and approved for, rather than having it be sort of prescriptive level 3 or level 4. So if someone does require any home modifications or any aids and equipment that would go over what's generally considered the level 4, they can have individual approval for that. And this actually brings me back to, over the years, there's been a lot of advocacy for a higher level than level 4, sort of like a level 5. So, that's something that certainly many people have been talking about, because quite often the level 4 funds are not enough, particularly for those people who do require aids and equipment, which can quite often go into tens and tens of thousands, and it just doesn't cover. So I really feel for this person here, and what I would recommend is going through their provider and having that open discussion and just see where they can go from there.
Well, Terry, we've come to the end, not that we've answered all of the questions, but I'm sure all of the people that are still with us out there know exactly why we employ you. You've given a lot of practical advice, which I know many people are grateful for. COTA New South Wales is very grateful that you're on our staff because of your level of expertise and commitment. So thank you so much, Terry. That was terrific. And
Can
I know,
everyone see my screen there?
yeah.
I've got our my contact details, well, our contact details, myself and Caleb. We're here to take your calls, your emails, help you through. I know someone had a question in there also about fees, and it's quite confusing. As I said, we can sort of explain the basics to you when it comes to sort of daily fees and things like that, but the more nitty-gritty, we're not really equipped to discuss. But please contact us, the Aged Care Navigator program. You can see there a couple of phone numbers, our email address, also our website, and I'd be more than happy to have a chat with you.
Great. And also Caleb's been with us as well. That's Terry's offsider, his co-workers. So the two of them do an amazing job, and I congratulate them publicly because of the commitment that they have, and now that their level of knowledge has become even broader than when they first started. So folks, that brings us to the end of our webinar. I would particularly like to thank our guest speakers, in particular Paul, Judy and Terry. Remember that we've got that information that Terry has just put up, and Terry and Caleb are there to answer your questions as best they can. Remember, we have community speakers. They're our volunteers. Judy's one of those. So don't forget to stay in contact with us, and those people can come out and deliver sessions on a range of topics that they've been trained to do. So don't forget the community speakers. We have our next one coming up in July. So keep attuned to all of the things. This one's about entrepreneurs who are seniors, so that will be a really interesting webinar. Folks, stay warm, stay safe, and thank you so much for joining us today. It's great that I can be back doing these webinars and conversations with older people on behalf of older people. So thank you very much, and we'll see you again soon. Don't forget, this has been recorded, so if you want to share it with your friends and colleagues and neighbours, it'll probably be available either tomorrow or the next day. So look out, COTA New South Wales YouTube. We might become an Oscar winner one day. Who knows? Okay, folks, stay well. Great to be with you all. Thanks, Judy. Thanks, Terry. And we'll catch you soon. Bye for now.